Euthanasia is an ethical issue that is argued around the world. Euthanasia is the termination of a very sick person's life in order to relieve them of their suffering. Euthanasia is also called as self-deliverance, suicide, aid in dying, auto-euthanasia, or assisted suicide. Euthanasia is a term derived from the Greek word eu, which means good, and thanatos, which means death. It literally means good death. However, not everyone likes the idea of legalizing euthanasia, especially in the United Kingdom. So should euthanasia or physician-assisted suicide be legalized in the UK for adults? I think euthanasia or physician-assisted suicide, also known as PAD, should be legalized in the UK, and this is because of three main reasons. Euthanasia relieves suffering, is regulated by the law, and gives choices for the patient. Although euthanasia is thought as going against God's will, many Christians believe God they worship is loving and tolerant and would not like to see them in pain. Pain and suffering is a major argument for euthanasia. Euthanasia can relieve the suffering of the patient. Most patients who receive euthanasia are with a terminal illness. According to a survey done by the Opposing Viewpoints in 2012, more than 78% of the patients in the Netherlands who received euthanasia was suffering from a cancer of some sort, and the remaining reports were by patients with other terminal illness, such as cardiovascular disease, neurological disorders, and mental illness. These illnesses are very hard to relieve pain with medical assistance. The Netherlands legalized euthanasia in 2002, and the survey was done 10 years after. This shows that euthanasia is used by patients who suffers, not for anything else, even after 10 years. Euthanasia is a good way to relieve suffering of patients with severe conditions. Some might say that legalizing euthanasia might lead to a slippery slope to the unnecessary death of the disabled, but legalizing euthanasia can actually make it safer for the patients. According to the Opposing Viewpoint, a survey in 2001 in the Netherlands and 5 other European countries, including countries that banned euthanasia, found that some form of assisted suicide occurred in every country. Putting regulations will prevent the unnecessary use of euthanasia. There are regulations that prevent patients from just giving up on their life the minute they hear about their terminal illness. Also, to make sure the patient is not making a hasty decision, the patient needs to request 2 times, which is at least 2 weeks apart. According to the Opposing Viewpoint, the rate of euthanasia in the Netherlands in 1995 was 2.4%, and in 2005 it was 1.7%. The rate of euthanasia is actually decreasing after it was legalized. The regulations for euthanasia prevents the hasty decisions that the patients make. As a human, we have the right to make decisions for our lives. However, patients only have a few choices they can make about their illness. These are things such as having a life-saving medical treatment that stays with them forever, treating the pain aggressively, or having suicide. Euthanasia can be another choice for them. Some might say that patients end up making hasty decisions for their lives. However, a research done by the Opposing Viewpoint showed that almost half the people who chose euthanasia had a life expectancy of less than a week. Only 8% of the patients had more than a month. RSC also reported, life-terminating act without explicit request of the patient typically involves patients who are very close to death and are presently incompetent, but where there has been an earlier discussion about hastening death with them and or their relatives. Also, euthanasia improves the decisions made by the patients. Derek Humphrey quoted, "What many people do not realize that for many people, just knowing how to kill themselves is in itself of great comfort. It gives them the assurance to fight harder and therefore often extend lives just a bit longer." Legalizing euthanasia will give patients choices about their illness, whether it is to treat it with other medical treatments or relieve the pain with euthanasia. In conclusion, I think euthanasia or physician-assisted suicide should be legalized in the United Kingdom for adults. This is because euthanasia relieves suffering for patients with terminal illness. It is regulated by the law, so it will not end up in a slippery slope. And also, it gives choices for the patients, and it actually gives comfort for them.